This is the story of Silva Chiranda. Like many in Africa, he lives off the land, tending his cattle in rural Mozambique. He lives at home with his wife and 5 children. This is the story of how Silva has chosen a path that is changing the face of his country. It is also the story of people like this woman. She was in poor health and gave birth to her baby at home with no obstetric care. She had to be rushed to the hospital.
Como vem, está muito magrinha, mas está grave. A situação não está nada boa.
Within 24 hours of when these pictures were taken, the woman died. The lack of emergency obstetric care in some countries is now a worldwide concern. In fact, when you consider pregnancy-associated deaths, mothers, babies who die shortly after birth, and stillborns, the number of pregnancy-associated deaths is 7.5 million every year. In the face of those grim statistics, people like Silva Chiranda are making choices, choosing to find ways to improve maternal health and health care for all.
Fraturou. Estão a ver aqui uma desunião. Então a gente tem que tratar. É uma das urgências minhas, né?
Silva is what is known in Mozambique as a técnico de cirurgia, a highly trained clinical health professional. Though not a doctor, his ability to find innovative medical solutions is helping to transform the healthcare delivery system in his country.
E porque não temos material próprio, a gente improvisa, né? Estou a fazer isso em substituição do material que eu devia ter, que é o ideal, que não tenho. Então sou obrigado a inventar alternativas. Aqui na parte de
It is exhausting work. He sees patients of all kinds, 20 hours a day, 7 days a week. And he is the director of the clinic with administrative responsibilities. He even drives the ambulance on emergency calls.
Tivemos uma solicitação da ambulância para evacuar uma senhora grávida em trabalho de parto.
Mozambique trains people like Silva for 3 years to perform surgery. In addition to the classroom, there's hands-on surgical instruction provided by doctors.
Não é fácil nós entregarmos uma faca a quadro médio de saúde para executar tarefas que eram só da responsabilidade de especialistas.
Today, several studies show the Technico's surgical results are comparable to those of fully trained surgeons.
Próxima vez ela vai fazer sozinha.
Formar um cirurgião leva, na nossa carreira profissional, leva 15 anos ou mais, ao passo que formar um técnico de cirurgia é muito mais rápido.
It is quite remarkable to note that in all district hospitals in the country where the vast majority of the population live, 90% or so of all these big life-saving operations are carried out by these technical surgery, and 90%.
People like Silva provide a solution to the critical shortage of medical doctors faced by countries like Mozambique, where there is only 1 doctor for every 23,000 people.
Thank you so much, Gabriel.
At the direction of the Ethiopian Ministry of Health, the lessons learned in Mozambique have become part of a growing collaboration among African nations.
And this idea actually evolved from that real experience during the field. And this experience also is not new to the rest of the world also. Even during the Second World War, France has used it, trained its nurses in emergency surgery. And when there is a need arises, you do something that fits the business.
Between need, knowledge, and human creativity, we can create solutions to profound human needs. Bringing knowledge and need together to spark innovation in perhaps ways that were not previously imagined.
In 1 year alone, Técnicos de Cirurgia like Silva will complete 58,000 operations. In rural Mozambique, that's 9 out of 10 of all obstetric surgeries, such as hysterectomies and life-saving cesarean sections.
The problem is access, and that means that we need to be thinking about how to change health strategies so that they're really reaching the poorest, the least well-served, the most marginalized in a society. Those are the women who die.
Without innovative health strategies, Silva would have been unable to respond to the woman whose labor threatened to kill her.
Por isso que temos que preparar para a cesariana. Já fiz bocadinho mais de 1000 cesarianas. Cesariana é o que eu mais faço.
His skilled hands not only delivered the woman from danger, he delivered 2 healthy babies, twins who returned home with a healthy mother. Lives saved because of a country's commitment to make hard choices for better health care for all, and one man who chose to find healing solutions, no matter how difficult.
Isso não posso dizer que, olha, não vou operar porque estou cansado. Então, mesmo que eu esteja cansado de que maneira, tenho que encontrar forma, tenho que encontrar energia para fazer qualquer coisa para salvar a vida da mãe que esteja em risco.